CNBC is looking at how places around the world have tackled COVID-19. By talking to a wide range of experts, as well as everyday citizens, we're taking stock of what's gone well, and what hasn't. Vietnam has confirmed 412 cases of COVID-19 and reported no deaths in a country of 95.5 million. The country took strong early action to stem the spread of the virus, and many locals have now deemed the efforts to be highly successful. Some recent reports, which is still far from proven, indicates Vietnam may not have been immunologically naive, because something resembling SARS-CoV-2 might have been circulating for years. That theory is still yet to be proven. Others have speculated that the data isn't trustworthy, but local researchers largely believe it is. Vietnam now resembles normalcy, with its bars and restaurants open. In April, it donated hazmat suits and masks to harder-hit countries in Europe and the United States, where millions of people have been diagnosed with the virus. Aggressive contact tracing: the first case in Vietnam was reported in late January and involved a man and his son returning to the country from Wuhan, China. A week later, the country sprung into action with a whole-government strategy, which many believe it has been prepared for since the SARS pandemic of 2003. People who tested positive for the virus and their close contacts were placed into quarantine camps for 14 days. The contact tracing, as outlined by the researchers from Oxford University's Clinical Research Unit in Vietnam, incorporated 3 degrees of separation. People who came into close contact with people who came into close contact with someone known to be infected with the virus were told to isolate at home. Dr. Julian Pham, a Vietnamese-American physician and investor living in Boston, recalls feeling apprehensive when his father announced he would be returning to Vietnam for a Buddhist pilgrimage in early March. Pham's father, who's also a doctor, traveled from France to join up with a group of more than 30 people. Almost immediately, the government stepped in, Pham said. Because of his connections in the country, his father was able to stay with family at home for 14 days. But by mid-March, anyone entering the country was sent straight to a quarantine center where they remained for 2 weeks. At the outset of the pandemic, Vietnam urged local medical equipment companies to help them ramp up a testing program. By April, the country had already performed hundreds of thousands of tests. At that time, for every confirmed case, the government was testing almost 800 people, by far the highest in the world. The next highest, according to data compiled by Reuters, is Taiwan, which tested 140 people for every case. According to a research report, Vietnam went from having just 2 testing sites nationwide in late January to 120 by May.